So today I would like to welcome our guest, Dr. Sneha Pandey, an anesthesiology resident from Rajendra Institute of Medical Sciences, Ranchi. Also, she has been my batchmate since my MBBS times. Hi, Sneha. How are you?
Hi, Bruce. I'm very good. And yes, it's very nice catching up with you after, I think, 2, 3 years.
Hi, Sneha. Welcome to the podcast.
Hi, Bruce. Thank you so much for welcoming me here. So, after joining anesthesiology, and as per my experience, anesthesia as a branch is a very good branch. And at at that rank, which I have got I have got anesthesia, it's a very good option if you want a clinical field. But there are things and your demands as well, which may not allow you to take anesthesia because there is a little work-life balance issue in anesthesia as a branch. But if you're okay with this, you can go for anesthesia anytime. Certainly. And plus point is, if you are one of those people who don't want patient interaction so very much, and you are okay with working behind the curtain and going home with your money, so it's really a good branch for you. But if you want that fame of a doctor and you want to attend OPDs and patients and you want to hear your name from patients, then you should go for some other clinical branch, definitely.
Okay, so Dr. Sneha has crisply defined everything about the branch anesthesiology. So my first question would be, how what can aspirants expect from anesthesia as a branch, and what an overview can you give about anesthesia as a branch,
As I
like
said,
what the
if you are
branch
okay
involves?
As I said, if you are ready to work behind the curtains and be happy with the money, you are good to go with anesthesia. First thing. Second thing, if you are okay working in OTs your whole life, then anesthesia is for you because you won't get OPDs. Hi, yes, pain as a branch has become the part of anesthesia. Certainly, you can get into this branch, attend pain clinics. But if core anesthesia, you will ask me, yes, definitely. You would not get patient interaction so very much, and you would be in OTs. Third thing, if you ask me about work-life balance, there may be times, and as you know, that emergencies have got no time. So you will get cases at nights also, and you need to be available all the time. So certainly there will be a work-life balance issue. So if you are
Okay.
okay with these things, you can opt for anesthesia, anything.
So it's a mix of hectic plus easy parts
Yes,
at some point of time, but yeah, it's a mix of both, and we need to deal with the emergencies now and whenever we are on call. So yeah, it's a mix of
yes.
everything. Okay.
Yes, yes.
So
And
my
if you
second
are the
question,
person who
yes,
wants adrenaline rush, definitely you can opt for anesthesia because there
anesthesia is
are
a branch.
emergencies and the procedures you get to do, which will give you adrenaline rush and you'll be happy with that. So yeah, it depends. It totally depends on your priorities, what you want from yourself and your life. So based on that.
Okay. So also I have heard that you have to go for ICU shifts and everything for longer durations of time, like for 24 hours, 36 hours at a stretch. So what would you have to say about that? Like, it's
Definitely, we do get our duties in ICUs and also in OTs. You are always, whenever you have emergency shifts, uh, you need to be available for cases as well. So there is not much difference that if you go for ICUs or you are available for OTs because you need to be there. In ICUs also, you have all the critical patients there. So in shifts, ICU shifts also, you need to be available and duty hours are really long hours. So you get duties for
longer,
24,
hectic
36,
hours.
48 hours like that. So it will be a difficulty if you are not a person who is ready to work for longer hours and you need a little balance, then it will be difficult. But yes, you need to choose what you want.
Okay. So my second question to you would be, how should a aspirant basically align his or her NEET PG rank with the choices that he has in hand? Okay, so like someone can get anesthesia, surgery, ophthal, and all these branch in this. So how one should align this based on his work-life balance that he
Uh,
wants or
at this
he wants
branch,
in future?
definitely you have clinical and non-clinical options both available for you. So in
Yes.
clinical options, the rank where you can get anesthesia are eye, ENT, definitely ophthalmology, and ENT and anesthesia as clinical branches available to you. But you need to choose what are your priorities. As I already said, that if you want work life balance, you want to go by like 5 at your home and sleep peacefully, and you want a peaceful life, then definitely you can't go for anesthesia because cases won't wait for you to like be available na. So if you want a
Right.
peaceful life and less emergencies, then definitely Dr. Gurus is better equipped to tell you that uh, s- uh, I and
Yes.
ENT is a better branch
Go
than
for
anesthesia for that
INT.
matter.
Yes.
But yes,
We have
but
lesser
if you are
emergencies to
okay
deal
to
with,
do
not like
emergencies,
anesthesia. Yes.
yes. So if you are okay to do
Great.
emergencies and you can be available at nights, then you can go for anesthesia at this rank. And all non-clinical branches are also available at this rank, so you can choose among them, definitely.
Okay. So it is like, so this work-life balance goes like for the whole of your life, or it just gets easier with time, or how would you like to describe it?